Here all the patients are homeless. There is nobody who has a family.
Homeless patients who have septic come here and who are treated and they go there.
Assalamualaikum. So today we are here at the Smile Health Center, Medical Care and Recovery Center, Depot Circle, Avadhanma.
We are here in Avli today to visit MCRC Medical Care and Recovery Center, where homeless neighbors are feel seen in Bangalore, respected and reintegrated into society. Okay, Simran is walking us through the Smile Center over here. Yes, Simran.
Yeah, so MCRC is basically divided into few parts. Like we have a priority care ward, like we have 4 beds in which we treat the priority patients who are at high risk. Like we continuously monitor them, who has breathing difficulties and who needs continuous monitoring, we take them here. And this is called as a septic ward, where the patient comes with a lot of wounds. For example, this patient who has a wound on his leg. So this part of MCRC is only for the patients who has wound, like it is called as septic ward.
Okay.
This ward is called as aseptic ward, where
What does aseptic mean?
aseptic means there is no infection, like no wound, nothing. The patient has only fever, vomiting.
So homeless patients who have septic come here and who are treated and they go there.
No, it's not like that. Like here all the patients are homeless. There is nobody who has a family. They might have far relatives who visit there once or twice, but everybody are homeless. We directly rescue them from the streets. Patient who comes with lot of wounds, like they have fallen on street, they don't take care of the wound, who has lot of infection, means they are shifted in septic ward. The patient who has only fever, respiratory tract infections, viral infections, they are shifted this side. And the normal patients who has like diabetic, hypertensive, cardiac issues, they are shifted there. We have one isolated bed below to the exhaust fan. Like if we suspect a TB or any more respiratory tract infection, we keep the patient in isolated, then we shift them to the higher shelter, like tuberculosis shelter, if they are diagnosed with it.
Okay, if they have TB, then you
Yeah.
take them there. Can you speak one of your shelters? I see a lot of patients here. Can you speak to him?
He's deaf and dumb. He is not able to.
Okay, it's deaf and dumb and homeless.
He is deaf and dumb and homeless, and he also was not able to see anything.
Okay.
But we did his cataract surgery in Vittal Eye Hospital, and he is able to see now.
Okay, so can we speak to him? Okay.
He is Jairam. He is both hypertension and diabetic. He has wound on his right leg. Idu torsi, kaal torsi. He has wound on his leg. The wound was very big. It was massive till here. But we do his daily dressings and all, and it has been cured. And it's just a little wound, minor wound, and we also do alternate dressings
Yeah.
here.
Can I ask him a couple of questions?
Yeah, you can speak.
ಕನ್ನಡ ಬರುತ್ತಾ? ನಿಮ್ಮ ಹೆಸರೇನು?
ಜಯರಾಮ್ ರೆಡ್ಡಿ
ಎಲ್ಲಿಂದ ರೆಸ್ಕ್ಯೂ ಮಾಡಿದ್ದು ನಿಮಗೆ?
ಸರ್ ಅಲ್ಲಿ ಹೋಗ್ಲಿಪುರಂ ಹತ್ರ ಕೂತಿದ್ದೆ ಅಲ್ಲಿ ಒಬ್ಬ ಮೇಡಮ್ ಬಂದು ಕರ್ಕೊಂಬಂದು
ಎಲ್ಲಿ ಕೂತಿದ್ರಿ? ರೈಲ್ವೆ ಸ್ಟೇಷನಾ, ಬಸ್ ಸ್ಟ್ಯಾಂಡಾ?
ಇಲ್ಲಿ ಬಸ್ ಸ್ಟಾಪ್ ಹತ್ರ.
ಅಲ್ಲಿಂದ ಕಾಯಿಲೆ ಆಗಿತ್ತು, ಈ ಥರ ಬಂದು ನಿಮಗೆ ರೆಸ್ಕ್ಯೂ ಮಾಡಿದ್ರು. ಹೆಂಗೆ ಟೇಕ್ ಕೇರ್ ಮಾಡ್ದವ್ರು ಇವರು?
ಸರ್ ಇಲ್ಲಿ ಸೂಪರಾಗಿ ಮಾಡ್ತಾರೆ ಸರ್. ನಾಷ್ಟ, ಊಟ, ಕಾಫಿ ಎಲ್ಲ ಮಾಡ್ತಾರೆ ಸರ್.
ಟೇಕ್ ಕೇರ್ ಒಳ್ಳೆ ನಡೀತಾ ಇದೆ. ಡಾಕ್ಟರ್ ಎಲ್ಲ ಬಂದು ನೋಡ್ತಾರೆ ನಿಮ್ಗೆ?
ಸರ್ ಮಾಡ್ತಾರೆ.
Okay, so as you can see, the Jairam is over here in a homeless, and we saw one more homeless patient there who had a cataract surgery, and few of them are seated here. We'll just go through them. But as he was rescued from a bus stand nearby, then he was treated here, and then he is getting recovered, and then after that there's rehabilitation, I guess, and after that and family reunification.
There is no family. Like we take each patient's case study every month, whoever comes here for the newly. So
Because usually the homeless comes in, you get treated, and then it's rehabilitation service, and then you
primarily.
and then you reunify with the family, right?
No. Like most of them doesn't go back to family because their family has abandoned them. So they prefer not to go back to families. But if like for example Jairam, he is an old age and he doesn't want to work, or nobody gives him work. So we ask him with his preference, we shift him to the old age homes like ashrama kind of shelters. So if he wishes to go back to shelter and stay there till his lifelong, he can stay there, or else he wants to find some work and continue his daily wages, means he can go back to his work. But most homeless doesn't prefer to go back to their families.
I see a lot of homeless seated there. What is this? Like?
We do have this recreation activity hall It's like a patient do daily activities here. We have a monthly calendar. We have TV timings. Like everything here is arranged in a timetable.
I see some TV timings here. Okay. So during this time you put them TV, is it?
TV.
Okay.
They watch TV, they play carom, they play ludo, they have lot of activities. We even take them outside for the park visit, lake visit. Yearly once we take them for a long trip. Recently in the month of April we went to Mysore. We took them.
So you take all the homeless to Mysore.
All homeless for a day trip. We take them outside. We even take them for a park visit, lake visit in the evenings. Like we have a monthly calendar of activities. There it's located. They has recreation, like they mingle with each other.
So each every individual is rescued from a different location, different spot, which we went through like a hub and then hotspots and stuff. Okay. So can we speak to one more patient? Like,
You can speak to him.
Okay.
He's been here since an year. Since a year, he also came with the complaints of wound on his leg. So he's been currently getting his treatment from HBS hospital. It's been recovering. Like he's not diabetic, not hypertension. He's been getting his dressing done here daily. We do his dressings and he's been recovering here.
ನಮಸ್ಕಾರ ಮೋಹನ್ ಅವರೇ. ಎಲ್ಲಿಂದ ನಿಮಗೆ ತೊಗೊಂಡು ಬಂದ್ರಿ ಇವರು ಮತ್ತು ಏನು ಕಾಯಿಲೆ ಇತ್ತು ನಿಮಗೆ?
ನಿಮಗೆ ವೆರಿಕೋಸ್ ಇದೆ. ನಮ್ಮ ಎಸ್.ಎಂ. ಸೆಟ್ರಮ್ದು
ಎಲ್ಲಿ ಶೆಲ್ಟ್ರಿಂದನಾ? ಹಾಂ,
ಅಲ್ಲಿ ಬಂದಿದ್ದೀನಿ. ನಮ್ದು ಕಟಿಂಗ್ ಶಾಪ್ ಕೆಲಸ ಮಾಡ್ತೀನಿ. ಹೌದು,
ಕಟಿಂಗ್ ಶಾಪಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ರಿ ನೀವು. ಎಲ್ಲಿಂದ ನೀವು ತೊಗೊಂಡು ಬಂದ್ರಿ?
ಏನು ಅಲ್ಲಿಂದ ಕರ್ಕೊಂಬಂದರು ಆಶಾ ಮೇಡಮ್ ಅವರು. ಅಲ್ಲಿ ಇಲ್ಲಿ ಕರ್ಕೊಂಡು ಮಾಡಿದ್ರು.
ಹೌದು, ಆಶಾ ಮೇಡಮ್ ಇಸ್ ದ ಸೋಷಿಯಲ್ ವರ್ಕರ್. ಓಕೆ.
ಹೌದು ಸರ್.
ಮತ್ತು ಹೆಂಗೆ ಟೇಕ್ ಕೇರ್ ಮಾಡ್ತಾವ್ರೆ?
ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ. ಸಿನಿಮಾ ಎಲ್ಲರೂ
ಊಟ ಎಲ್ಲ?
ಊಟ ಸೂಪರ್ ಆಗಿದೆ. ಎಲ್ಲ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೋತಾರೆ. ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ.
Okay, so there's one more patient of homeless. As you can see, there are a lot of homeless people here playing ludo, carom, and there's a TV there, and we see a timetable and TV timings here. So
All the drawings here, all the art and craft, everything is done by our patients.
oh, this art and craft is done by patients. Okay, so so one more thing to learn is that Smile Center, this painting is done by the homeless patients over here. Who are getting treated, which is amazing. I didn't know that. So who did this painting? Any idea?
There was a patient called Jane. He was almost 70 years old. He was randomly, we had an activity of painting. He told he'll paint it in a good way, and he did all this. He has even painted Abdul Kalam.
Oh, nice. So one patient just painted the whole center of yours.
Yes. And the other patients also has did lot of drawings, these mandala paintings and all.
Okay, that's great. Okay, so thank you, Sister Simran. She's a nurse over here working at the MCRC. So thank you for walking us through and just asking also patients a few questions and helping us. So yeah, that's it. Thank you very much.
Thank you.
So this is we are told this is the dining hall for homeless, where they have their breakfast, lunch and dinner on terrace rooftop, and they wash their dishes by themselves. And also if there are big vessels, they make sure they clean it. They give them the work to clean it over here. So hi everyone, so again we are meeting Dr. Abhishek in the MCRC center over here. So doctor, I'll be asking a few questions on the homeless patients over here. So what kind of patients do you usually get, and what kind of urgent needs do they need once they are rescued from the streets?
We see all types of acute cases and chronic cases. Acute cases are like basically trauma, hypertensive urgencies, and other wounds, ulcers, all these things. Then there are chronic cases like CKDs, chronic liver diseases, kidney diseases, and we see cases of stroke, and we see cases of epilepsies who has multiple episodes. These are the major cases.
And what do you think these psychological issues they have, because you mentioned the psychiatric cases, how do you handle them usually?
Usually they are aggressive because they are being in the streets, they are neglected, and they do not have any trust. So
They have trust issues. I agree on that. So let me understand the process here. So once homeless is rescued, he comes, we take them to hospital, get him treated immediately on the immediate basis. Then he comes to over here based on the case, and then you treat them and do you see addiction cases? I see a lot of alcohol cases back in KR market yesterday who were just lying down the street. So how do you deal with those kind of patients, and what do you usually do?
Because substance use abuse is the major issue in the homeless. So we have seen many cases.
So do you guys treat them and just leave it away, or I'm just trying to understand the process, what exactly goes in, because we rescue, we get them treated, and because at MCRC we do, it's a rehabilitation and reunification with families as well. So in order to understand the process, so what kind of what do you guys usually do with these kinds of homeless?
We usually refer them to the higher centers for the further evaluation for psychiatry. Then we get consulted from them. Then till they are here, we try to morally support them and educate them. This is the thing, but most of the time when we are left them to the streets, most of them get back to the same thing. Few get treated completely. They get de-addicted. These are the issues.
Okay, sounds good. Yeah, I don't think so. I have more questions for you. Just understand the process, how a homeless is rescued. He goes to hospital, get treated based on your eligibility criteria. He needs more care, then he's taken into MCRC center over here, and then you have rehab programs that you mentioned, and also then family reunification. So yeah, I'm not from medical background, so I don't have any more questions. So it was nice talking to you, Dr. Abhishek. Thank you very much for talking to us. Thank you.